And we're going to start in 3 minutes.
Oh, okay. I just wanted to make sure I got that right. You're going to do all that, right?
Yep. All right, everybody, we're going to rip it off in 1 minute. 1 minute, we're going to start the show. 1 minute. Everybody's having a great Saturday on the beach. It's a lovely day out. It's like a little rain out
here. It's a little cloudy.
1 minute, we're going to start right on time like usual. And you're on time too, which is always nice. It's not always the case, but you're on time today. Yeah. Oh, let's see who's watching. Christy's there.
Good morning.
Kevin is popping on. Our friends with the little boys. I forget which. Oh, Dad's here. Hello, Dad. From Orlando.
Good morning.
All right, 30 seconds, everybody. 30 seconds. Your co-hosts are bummed out. What does that mean? Oh, the kids.
Yeah.
All right, and we got a great show lined up today. Good morning, Jan. Thanks for joining us the other night.
Yes.
On the special show for Anita. That was cool.
Serenading us.
Yes. Yeah. Didn't know she was such a great singer.
And songwriter.
Yeah. All right, you ready? Here we go.
This is Beach Talk Radio.
Good morning, Mr. and Mrs. America and all ships at sea. This is your captain speaking, Mean Gene. Mean Gene. The following will be a test of the ship's whistle, the sonar alarm, the cable alarm, and the atomic attack alarm.
Live from Peach Time Out in the heart of Times Square, you're listening to Beach Talk Radio with Kim and Ed Ryan.
And welcome to episode number 108 of Beach Talk Radio. It's Saturday, April the 11th, 2020, and it is day 23 of Fort Myers Beach being closed to every single person, including the residents that live on the beach. And it's episode number 3 from our backyard studio, as opposed to being at Beach Time Out, which is really where we would love to be in Times Square on the beach, but it is what it is. And we have a super show lined up for you today, folks. And we're going to get right into it with Dr. Stephen Thomas, the Chief of Infectious Diseases in Upstate University Hospital. Doctor, thanks so much for coming on. We appreciate your time.
Thanks for having me.
Yes, and I just want to thank you and all the healthcare workers that are out there for tirelessly working to support patients and families who are dealing with this pandemic. So thanks to you and everyone, everyone everywhere that's dealing with this. So we appreciate you coming on and taking the time this morning.
Thank you very much. It's good to see the sun.
Yeah, we were just talking that you guys had a little bit of snow. Folks. Yeah. Did you hear that snow they had up there?
Easter Sunday tomorrow, and they have snow still in upstate New York. But before we get rolling with the questions, if you do have a question for Dr. Thomas, you can type it in the chat box today, and we will ask him. We don't know if he can answer every single question yet, but we'll give it a shot. So Doc, tell us exactly what you do at the hospital, and so people know exactly what you're dealing with now.
Sure. So as you mentioned, I'm the Chief of Infectious Diseases. So I'm an adult infectious diseases physician. And so normally what I do is I run a division of healthcare providers who take care of people with infectious diseases. And then another part of my job is I direct an Institute for Global Health and Translational Sciences. And so what they do is we do research and development of medical countermeasures against infectious diseases. So things like vaccines and drugs and diagnostic tests. But my new job as of the beginning of March is we have a COVID incident command here to try to respond to what's going on. And I'm the commander of that team. So it's about 75 to 80 people in the hospital that all have very specific jobs to prepare for and to react to the COVID pandemic that's occurring.
So, Doc, the question that I want to know is, how do people know if they should go to the hospital or if they just have a cold? Because if they don't know they have it, which a lot of people don't because of the testing, then they could stay at home and it could get worse. And then you hear people dying. So what is the proper protocol to follow when you're not healthy, when you feel like something's coming on?
Right. That is a really good question. And the answer to that has kind of been evolving over time. So the first thing is that it depends on what we would call the local epidemiology. So what that means is how much COVID is being transmitted in your community, number one. Number two, how strictly are you adhering to the social and physical distancing policies and recommendations? So are you freely going out, interacting with other people, and could you therefore be at risk to have been in contact with someone who was infected? And then the third thing to consider would be, there are certain people that do much worse with this disease than others. And so it would seem that people who are older have the potential to do much worse if they get infected. So people over 55, 60 years of age, people who have pre-existing medical problems. So things like diabetes or heart disease or lung disease or kidney disease. So those are some of the things that should get you thinking about whether or not you should see a medical provider. Now, in terms of the types of symptoms that you may have, unfortunately, the symptoms initially we thought it's people with fever and cough and shortness of breath. But what we've been finding out as the weeks go by, it can be a mild illness. So people may or may not have fever. They might have gastrointestinal problems like nausea or abdominal pain or diarrhea. They might just have a sore throat. They might just have profound fatigue and kind of generalized muscle aches. So my advice would be, if there is COVID in your community, if you are certainly within one of those risk groups and you do not feel well, then I would call your medical provider. I would explain how you're feeling and get their guidance onto where you can go to be evaluated and tested.
All right. And as you were talking, there seems to be there seems to be categories of people. So there's even people that are going around that are maybe infected but don't have signs. Is that correct? Mm-hmm. So everybody needs to take precautions and then there's other categories. Not everybody that gets it ends up in that 5% that's, right, really, really sick. Can you talk about some of the numbers and how that works?
Sure. Yeah, no, that's a really good point. So I like to think of it as an iceberg, right? And this is not unique to COVID. So the first thing I would say is that there's different terminology. So SARS-CoV-2, that is the virus. COVID-19 is the disease that virus causes. So you may hear both of these things. That's the clarification on that. So think of it as like an iceberg. And this is not unique to SARS-CoV-2 or COVID. This is how lots of viral diseases work. So think about an iceberg, and the majority of the iceberg is below the water. The part below the water would be the people who get infected and don't have symptoms, or the people who get infected and the symptoms are so mild that they don't even need to go to the doctor. So that's the bigger part of the iceberg, and that's typically the way it works. The part above the water, those are the people, that's the 20%, right? So those are the people that get sick and have a severe illness and need to go to the hospital, or people that get critically ill and end up being on ventilators or needing dialysis or things of that nature.
All right. And initially, when this came out, there was a lot of people on Facebook and whatnot that were like, "Oh, it's the flu kills more people every year. It's just the flu." What is the difference between COVID-19 and the regular flu?
Right. So the first thing is that typically influenza is seasonal, right? So it's fall and winter and into early spring. So our season up here starts around October and can go up until April, May. That's the first thing. It's seasonal. The second thing is that it usually comes on much quicker. So people can feel well, and then they'll have fatigue and muscle aches and fever, and they may have runny nose and cough and shortness of breath. It seems that with COVID, it can be a little bit more insidious and it can last a little bit longer. So we see lots of people who they don't feel great, but they're not really that bad for about a week. And then they kind of fall off this cliff and they can get very sick very quickly. But in general, it takes a little bit longer. So what you need to know about influenza is that the fatality rate from influenza is about 0.1%. The fatality rate for COVID is now in the United States, it's hovering around 3%. So that is a huge difference. Influenza kills about 40,000 people every year in the United States. So you can do the math pretty quickly to understand the potential here. The other thing is that influenza, we think SARS-CoV-2 is probably twice to maybe 3 times as infectious as influenza. So it's kind of the double whammy in that you have something that is more transmittable, more infectious, and it kills with a greater frequency.
Doc, when we do other shows with the mayor and some other shows, we get people that are kind of arguing with each other about the numbers and things like that. But I was wondering, and we have a question here today, if I get it, does that mean that, and I fought it off and I didn't have to take any drugs or I didn't have to go to the hospital, does that mean I'm cool then? I don't have to worry about it? Or, once it's gone through my body, is that the end of it?
Yeah, so that's a good question. And it's a question we're trying to figure out the answer to. If we believe, based upon our experience with other respiratory viruses and based upon our experience with SARS-CoV-1, so that was the SARS outbreak back in the early 2000s. Based on our experience with MERS-CoV, which is another coronavirus, we do believe that if you are infected and you survive, that you probably have immunity, which can protect you either from reinfection or disease following reinfection for at least a short period of time, a couple of years. That's the expectation. But to definitively understand that, we have to continue the research that we're doing and follow people who have been infected, who have recovered, and see how it plays out.
You're gonna pop that question.
Yeah, I'm gonna pop a question up from a viewer in a second. But what you said got me thinking of another one. How did the United States miss this? How does a country like ours miss something like this? So now the economy is totally shut down.
Yeah, so that's a really good question, and that's a question full of lots of political minefields, right?
Okay.
So what I can tell you is that the United States, for decades, has been investing heavily in pandemic preparedness. They have been investing heavily in what we call kind of a more general bio-preparedness. You can remember there was a huge investment after 9/11 and the anthrax attacks, not only in biodefense, but also in the defense against just naturally occurring infectious diseases, emerging infections, re-emerging infections. But the thing is, it takes a lot of political will to sustain these programs. It takes enduring funding to sustain these programs. You need to have a continual replenishment of subject matter expertise within the government and within the community. It has to be a priority. This was both, presidents, and I'm not getting political, I'm just stating facts, that past presidents have looked at infectious diseases as not just a health threat, but a national security threat. Mm-hmm. So, and again, there's been many examples of huge tabletop exercises that people have, that the government has sponsored or participated in, looking at scenarios such as this. So, I'm not in the federal government anymore. I don't know what kind of conversations occurred, but we are where we are. Probably not productive to look backwards yet. Probably more productive just to kind of focus on the now and the future and what we can do to try to minimize the damage here.
So we'll go to the question from Jill. Once we're all able to get back out on the streets, will we all get infected? Can you talk about herd immunity?
Oh, Jill, I love that question. So herd immunity, just to kind of explain, if I receive a vaccination and I develop an immune response that's going to protect me, I have individual immunity. If I vaccinate a population of people, anyone who can be vaccinated, then we develop population level immunity, which can protect people who can't be vaccinated, for example. So let's say that you have, 10 kids, 3 can receive their MMR, or 7 can receive their MMR, 3 cannot. The likelihood of those 3 children getting measles, for example, is much, much lower because the other 7 kids have been vaccinated, and it's going to be very difficult for the virus to make its way into that. So that's kind of the concept of herd immunity. I just had this conversation yesterday with somebody. Herd immunity relies upon the number of people who get infected and the number of people who develop immunity. For every disease, it's a little bit different, but typically it's up in the 70 or 80% range. So 70 or 80% of a population needs to have immunity for herd immunity to be able to protect everybody else who does not have immunity. I do not know, and I don't think anybody knows, what percent of the United States population, or even within states or even within counties, have been infected. And it goes back to the iceberg, right? Because the majority of people who have been infected, we probably don't even know that they've been infected, but they still likely have immunity. So Jill asked a really great question that unfortunately we're not going to really know the answer until probably a couple of months down the road and good antibody tests come out and we can do those sorts of studies.
And as of now, there's no antibody test to figure out who's been exposed and who has protection. Is that correct?
It would have been correct a week ago or 2 weeks ago, but the antibody tests are now coming online. And so the industry, commercial entities that develop these tests are engaging with the FDA. The FDA is giving them the go-ahead to start marketing these tests. So they are becoming available. How they're going to be used, that's another question. And how widely available they will be, that's another question.
And what about a vaccine? How far down the road do you think that is in your crystal ball?
In my crystal ball? Well, most of my career I've been working on developing vaccines. And so typically under normal circumstances, at least what history has told us, it can take up to 10 years and $1 billion to make a vaccine. Now, what we've shown with Ebola and MERS-CoV and Zika, and now with this, is it does not have to be that way. When there is focus and there is resources and there is communication and there is a broad community working on a problem, things can move much, much faster. That being said, I still agree with Dr. Fauci from NIAID that we are looking at least a year, if not 18 months, until there is a vaccine that would be broadly available. There are so many steps that you have to take, and in the end, you still have to prove it is safe, and you still have to prove it does what it is supposed to do, and that takes time.
Doc, when you're in the hospital with patients and with the team that you talked about when we first started, take us in that room. What's that situation like? Tell us about what you're all going through and how you prevent from every single one of you getting sick when you're around everybody that could infect you, and what kind of pain are they going through, and how does everybody deal with all that?
Yeah, that's a multi-pronged question that you just asked. So what I can tell you, and it's been every hospital.
All right. Well, it appears we're having a little technical difficulty
right on
now.
A good question. He froze up.
I know.
If he can hear us, maybe he can reset his phone. So we're speaking with Dr. Stephen Thomas, the Chief of Infectious Disease in Upstate University Hospital, and he's been giving us great information. which
And we appreciate your guys' questions
Yeah,
as well. We'll
yeah,
get
yeah.
to as many of them as we can. I mean,
yeah, I'm sure he'll reconnect and we'll get back to those questions, but we'll pop in as many as we can. And then as soon as we're finished with Dr. Thomas, Charlie McDonald is going to come on with us. And Charlie is he's a photographer in Naples, and he's had the disease, or I don't know if I should say he's had it or he still has it, but I know he had it for a while. There were a couple of news stories that that they did on Charlie. So we're going to talk to him. And then Janine's going to check in with us toward the end of the show and give us an update on how the shirts are going. That's one of the best programs that they came up with down there to help the people that are working in the restaurant business and also in the hotel business. So we're going to get an update from Janine on all that. And just like that, the doctor is back, and luckily we have a little bit of a radio background, so we can fill in the space there. That was a short commercial break, and now back to the doctor.
Yeah, technology. Okay, so what I was saying was personal protective equipment, right? The face shields, the goggles, the mask, the gown, the gloves. We are always in a balancing act because the supply and the resupply it's not guaranteed, right? So we have to operate under the concept sometimes that we have what we have. So we have to maximally protect our healthcare workers today, but also try to plan for a surge when there are going to be a lot more infected people in the hospital. So about a week and a half ago, maybe about 2 weeks ago, when the number of cases started to do this in our area, we went to universal masking within the hospital. Every patient who could wear one, every visitor, every employee walks around with one of these ear loop masks. So this is a mask that if you are sick, can help protect other people from getting sick. This isn't the mask that protects you from someone else who's sick, right? So everybody wears these for a couple of reasons. One, which you had mentioned before, we don't know who's infected. We don't know if they don't have symptoms. We don't know if it's before they're developing symptoms. So everyone wears one of those. And then when people have to go and see patients, they wear what we call this N95 mask, or they wear the battery operated, what we call a PAPR. It's a big hood with a shield and it's positive pressure there. If you go into the intensive care unit, what you're going to see, and this is kind of unique, it's not normally like this, you're going to see a bunch of rooms. Everyone's got their own private room. The door is closed, right? And you're going to see IV poles outside of the rooms. And you've seen this on, national television shows. You can, the nightly news, you see that. That's not typically what we do. Typically with the tubing is much shorter, but we now are using this really long tubing. We're putting the IV poles outside because nurses need to change things on IV poles multiple times an hour. If the thing was in the room, they would have to put on new PPE every single time, right? So it's lots of IVs. A lot of people, about 60% of our patients who we have in the hospital end up being on ventilators, so breathing machines. Some people need dialysis. Some people need even more intense measures than that. So these are very, very sick people. And then there's about 40% of people who are not as sick. They don't need an intensive care unit setting, but they're having fever, they have muscle aches, they have fatigue, they may have shortness of breath, they have cough. And again, there's no definitive therapy for this virus yet. And so we just have to treat their symptoms, keep them as comfortable as possible, and watch for signs that they might be going in the wrong direction and they need an intensive care unit setting. We have had very, very young people who they were doing okay. So these are people in their 20s. They're doing okay, and then they fall off this cliff. They end up in the intensive care unit. And then after a couple of days, they seem to rebound again. And that really makes everyone feel really, really good when you have a save and somebody bounces back.
And is that what's different about, about COVID, is that, you see this specific people seem to, it's obvious if you have a pre-existing condition that you're going to be at a higher risk for getting really, really sick. But then there's these sort of outliers that don't seem to have a pre-existing situation. We actually had that here in Fort Myers where a DJ got sick, and 39, I think he was, and he did not survive. And as far as we all know, he did not have a pre-existing condition. So you've got people they don't even know they were sick, and then young people who, for no other reason, and end up with a really unfortunate outcome. So any insights on that?
Yeah, I mean, there are the, I guess to quote the former Secretary of Defense, there are the known knowns, right? So we know that people that have COPD, or people that have kidney disease, or people that may have rheumatologic diseases like lupus and those sorts of things, and people that are more than 60, 70 years of age, we know that they have a much higher risk of not doing well with this disease and potentially dying from it. But then, they are the known unknowns, which is we know you're infected, but we don't know why you're so sick because you don't have any other medical problems. You're a young person. And those are the types of things that we're trying to look into. So is there a genetic component to this, right? So there's been a lot of news recently about the African-American population and how in some places they are disproportionately being infected and disproportionately having severe disease and not surviving. So is that something is that a genetic issue, or is that just another issue, what we would call these kind of social determinants of health, where people that are in certain socioeconomic status groups, or they're in, live in certain types of environments, always do worse with infectious diseases? So it's a good question. We're trying to figure it out. And it's the question that applies to kids as well, right? So we know children can get infected. We know that they can get ill, but for the most part, kids do very well with this disease. So why is that? Is it their immune system? Is it the fact that maybe their lungs and the types of what we call receptors that you need in your tissues where the virus will bind? Is it that they don't have the same receptors yet that adults have? Is it has something to do with infections you've had in the past? Because there's other coronaviruses that what we call community-acquired coronaviruses that circulate all the time. They've been circulating. I mean, we identified they were circulating, 60, 70 years ago. So does it have anything to do with that? So just lots of questions we just don't know the answers to right now.
Doc, are we at any point where you feel like the curve is flattening?
So what we have, you can look at a map of the United States and you can see where the activity is. And basically what you have is multiple epidemics within the United States. You have New York and Jersey and Connecticut. You have Detroit. You have Los Angeles. You have New Orleans. And the dynamics in all of those places are different. The factors that are contributing to the rate of infection, although there are many common factors, there are other factors that make it a little bit different. So it really depends on where you're talking about. So New York State, the governor has said a couple of times that, based on the information he's getting, that it seems like there are fewer and fewer new cases identified every day. Even though the death rate is going up, there are fewer and fewer new cases identified every day. So in this environment here, it is possible that the curve is actually flattening. I'm glad you asked the question, though, because what we have seen before, and you can go back, and there's plenty of literature on this. If you look at the 1918 influenza pandemic, which they believe killed anywhere between 25 and 50 million people, you can look at every single state in the United States and you can see what kind of measures did they take when they first understood that they had a pandemic, and how long did they sustain those measures. Let's just talk about physical distancing for a second, because what you saw in multiple states is they did a great job initially, and the peak of infections was low, but then they relaxed too soon. And the rebound of cases was twice as bad as what they had the first time. And again, this is being talked about in multiple places, and it is an absolute real concern, which is going to require people to have focus and discipline and resilience, or what we're experiencing now may pale in comparison to what we could experience in the future.
Fauci said on a Wall Street Journal podcast last week that he kind of judges things by how many hospital beds are being utilized for the virus. And if you see that to slow down, then that's a good sign that things might be flattening. What are you seeing there where you guys are?
Yeah, so we are on so if you look at New York and you look at the curve that shows new cases by day, you see what we call an exponential growth. So it's this kind of curving up like this, right? Almost like a bow. And that's really bad, because what that means is every day or even less than 24 hours, you're seeing a doubling of cases. The shape of the New York City curve is starting to kind of bend, as we just mentioned, to start to flatten a little bit. What we have where we are up in central New York is we have a straight curve. We have what we call a linear curve. So we're getting the same number of cases every day, 15 to 20 cases new every day. We are not seeing a flattening yet. We're just kind of, and it's a little bit eerie, we're just kind of plodding along, same number of infections, same number of people in the hospital. We have seen a significant decline in emergency department activity overall, but we're seeing a higher percentage of the activity that is there being related to COVID. So I agree with Dr. Fauci. You know, that's one metric that you can use to try to understand what the activity is like. Again, it has to be looked at a local level, because it also reflects what the availability of testing may be. It is possible there are lots of people who were sick, but they didn't get tested because they didn't have availability to testing, or people even who died that they did not determine what the cause of death was, right, because testing wasn't available. So I agree with him, and I would say, again, it has to be taken in the local context.
Is social distancing the answer? Is it working?
Yeah, so I guess the first point, I like the word physical distancing, because I don't want people to be socially disconnected or socially distant from people, right? I want people to continue. We need it more now, more than ever, right? Write your emails, chat, phone calls, FaceTime, have your Zoom, cocktail hours, do all of that. Listen to your show, do all of these things. Stay connected, right? Stay connected. But it's the physical distancing that needs to happen in a very rigorous way. And does it work? We know it works. We've known for over 100 years that it works, not just with with this disease, but lots of other diseases. And we know from, as we talked about before we went on the air, Korea and South Korea and Singapore, and we mentioned San Francisco. There are numerous examples with COVID where strict adherence to physical distancing, early adoption of physical distancing, it works. It absolutely works.
And now, yeah, and we like that term better than social distancing. That's a great term. Now that we're in it, as far as things that people can do to mitigate their, chances, we know about washing your hands, 20 seconds, using the, hand sanitizer with 60% alcohol. When you talk about the masks, I think we say all the time, you're not supposed to be using those N90. If you're a civilian, just be using a regular mask, your bandana, but that's preventing somebody else from getting it. It's not helping you to the extent that a regular medical mask would. Is that correct?
Yes, you are correct. So not all masks are created equal, and not all mask wearers are created equal. So if you have a source, if you've been able to find the source of a loop mask like this, or an N95, know that every mask that you buy that could be used for a medical provider, you are taking from that medical provider. And so some nurse or doctor or respiratory therapist or pharmacist or whoever who is putting themselves at risk to take care of their community, you are taking a mask out of their hands, right? So you're increasing the risk. So that's the first thing I would say. When you look at masks, so the N95 masks or the PAPRs, those are the best. 95% or greater efficacy at protecting the person wearing the mask. Ear loop masks like this one, or the tie surgical mask, those are less. Those are about 60 to 70%, right? And those are predominantly, like you said, from me, if I'm sick, from giving it to somebody else. And then you have the homemade masks, which are probably about 10 to 20%. They're not zero, but they really should not give you a false sense of confidence that you're saying, I'm wearing my homemade mask, which means I don't have to physically distance anymore. I don't have to wash my hands. I don't have to cover my mouth when I cough or sneeze. And that's one of the downsides of universal masking as a nation, is that people could potentially forget. Now, there's a lot of positives, though. Again, it's not zero. It's still about 10 to 20%. But it can also remind people, listen, we're still in a pandemic. We still need to wash our hands. We still need to physically distance. It's not this abstract thought. It's, wow, I'm looking around and a bunch of people are wearing masks. And it's also good to reduce stigma. If you're the one person in the room of 20 people that's wearing a mask,
Yeah.
That's one thing. If you're one of 20 people wearing masks, it's a whole different thing. You're all in this together.
Should we in the future never shake hands again? And I mean, things are going to be different. I mean, a guy went to shake my hand the other day and I said, are you kidding me? Get away. No, I mean, we could still say hi, but
Right.
I mean, there's certain things that will avoid germs changing hands forever. Right.
Yeah. I think, I haven't wrapped my brain around what new forms of salutations will be in the future. But I will say this: I am hoping that this motivates people to become frequent and habitual hand washers for the rest of their lives. Because COVID or not, tons of things are spread every day by touching something or touching somebody and then touching your eyes, your nose, or your mouth. So it's not just this; it's bacterial infections like MRSA. It's any things that can cause diarrheal diseases, norovirus, things like that. So I don't know what greetings will look like in the future, but I do hope that people really start washing their hands habitually and for the rest of their lives, because it will help in many ways.
What worries you the most, Doc? What worries you the most moving forward?
What worries me the most today is that when people, you can look on social media, you can talk to people in your community. Folks are fatigued, they're tired, they're not, they're being less receptive to the same message that they've been hearing about the need to physically distance. They're starting to see some positive signs that maybe case numbers are going down in certain areas. I am really concerned that people are going to lose their motivation to continue physical distancing. They're going to revert back to old ways too soon. And we are going to see that rebound effect that I mentioned earlier. And that rebound, that curve is going to dwarf what we've already seen, which is going to mean tens of thousands of people dying, and the medical care infrastructure being completely overwhelmed, and the economic pain and suffering that people are experiencing is going to be, much worse. I see a lot of things out there. The cure is worse than disease. Yeah. I can guarantee you that is not the case. I can guarantee you that is not the case.
When you're talking about, the time, and I know it's hard to say, but what is that time frame before,
when do you think it'll end?
Yeah. So like a lot of academic groups, we're a medical university, right? We have, we educate new doctors, we have researchers. So we have our own curves that are built specifically for Central New York. And I learned a good lesson, because on those curves, we show the worst case scenario, and then we show variations of the worst case scenario depending upon the physical distancing that we see going on in our community. The curve we're not showing, which we're going to start showing now, is what the best case scenario could look like. So the best case scenario would be 70 to 80 or even higher % of the country takes physical distancing seriously, that it is strictly implemented. And if that happens, there is the potential that we can really drive new infections way, way, way down, and that we could have a quicker release of these sorts of draconian measures that we're being required to implement. So it is sort of like we haven't really shown people the carrot, right? We haven't shown people what is actually possible. What they look at is they say, oh my God, 3 months, so if we do nothing, this thing will burn out in 2 months. If we do the best thing, it's going to burn out in 6 months. It gets people very deflated. There is another curve, and that curve is 70 to 80% of the people staying at home, washing their hands, social distancing, only essential visits, food, water, medications. That curve can be shorter, and it can be smaller, and it can result in our ability to get back to whatever the new normal is much quicker.
Well, Doc, we can't
you.
thank you enough. The people on the beach are really appreciative of all the information you provided, and we could talk for hours, but you have a job to do, I think, and it's a lot more important than what we're doing down here sitting in the sunshine. And it's been an amazing interview, and we're going to repost it for the people that weren't able to jump on. We had a big audience for you this morning, but it's going to get bigger when they come back and watch it later on. And so thank you very much, and enjoy the snow up there in Syracuse, and have a happy holiday weekend.
Yeah, thanks. You too. Thank you very much.
Thanks a lot,
Bye.
Dr. Stephen Thomas, and we really appreciate his time. That was an awesome interview. What a super nice guy.
I mean, it could have gone on.
Yeah.
I mean,
there's just
there's so many
thousands and thousands of questions. And before we pop Charlie up here from Naples, I want to make sure that we acknowledge my cousin, Angel, who our aunt, my aunt, not her aunt, that would be her mom, had been in the hospital, 81 years old with the virus, and she's recovering. So obviously when you're a little bit older, you worry that that's not going to happen, but that's nice. And Angel, thanks for sharing that with us, and send our love back to everybody in the family.
That's a good Easter.
Yeah. Right now, we're happy to have Charlie McDonald on. Charlie, can you hear us?
I can hear you greatly.
Oh, good. There's your sound. We're great. It's great to hear you. And Charlie is down in Naples. And before we talk about the virus that you picked up, tell us about your business, Charlie.
Well, what business? No,
right.
No, we're a very, very busy event photography business. In fact, that's what we concentrate on. So as you can imagine, we had a wonderful season until all of this came about. But fortunately, we had done so many events and got so many in the can prior to the cancellations that we're going to be okay for a while. But interesting.
Yes. So how did this all come about for you? Can you give us a little bit of how this, started and has progressed and how you're doing now?
Yeah, it happened because we're event photographers. One of my employees was covering a conference at a large hotel. This would have been now timeline probably over a month ago, and people were flying in from all over the country for the conference. They were shooting it for a day and a half, lots of interaction with the subjects at the conference. And I would say that was, I think, on a Wednesday, Thursday, and then the following Tuesday, there came a little bit of a cough. And that was before everybody was hyper vigilant about coronavirus. But it was starting to be talked about, and cough. Then the next day, a lot more coughing. I have an office. She has an office, but we share an editing suite. So you're sharing a mouse, this mouse in particular, and a keyboard, and going back and forth. And so she decided, you know what, I better leave work. And the next day she got tested for no flu, got tested for coronavirus. Her results came on the Sunday, but the Saturday morning I woke up with a fever and a cough. And I said, okay, guess what? I'm going down that road because I just never get sick.
And so then you went and got tested. You contacted your healthcare provider, got tested.
Yeah. In fact, I contacted my healthcare provider on the Friday before I even showed symptoms, because I just wanted to alert her to know that, hey, somebody that I work closely with has probably or possibly contracted coronavirus. Don't know till the test results are in, but just wanted to let you know.
Right.
And then over the weekend, when I was informed that my, coworker had actually officially the results came back, I popped a quick message to my physician on the Sunday to let her know when she came into the office on Monday morning. Perfect. She sent me an email back saying, I've written you an order for your test. Go to Naples Medical Center, call them ahead of time. Great protocol. They knew precisely the moment I was going to be walking in the door so that I wouldn't be around anybody else. They had somebody meet me who was masked up, took me 10 feet away to an examination room where we did the wonderful swab up the nose.
Yeah, we've heard that. That's pretty aggressive.
Yeah, as the nurse explained to me, first of all, she said, let me know when it starts to hurt. I have a high pain tolerance, and I talked to a couple of people who've had the swab where it actually drew blood. Didn't draw blood on me, but she said, the efficacy of the test, it's important to get up there and get as far into your nasal passages as possible.
You would think there'd be another way of them to figure that out. But somebody, I was listening to a radio show yesterday, and he got the disease too, and he said it felt like they were pushing that thing through his brain. And I mean,
exactly. That is exactly the feel. The tears well up in your eyes.
Oh my.
And I never sneeze, and of course, sneezing is a bad thing if you've. But that introduced a couple sneezes in me about 2 minutes later, just reacting from the swab. But you got to do what you got to do.
How sick did you get, Charlie? I mean, how bad did it feel, and did you get worried?
Yeah, I was lucky. My employee was flat in bed for 5 days, just absolutely felt like she'd been hit by a Mack truck. With me, I don't usually, I am lucky. I don't usually have big symptoms if the flu or a cold's going around, but my temperature spiked to 103 a couple times. Oof. I'm thinking, okay, this is not good. So I live by myself, which is good in a sense because I didn't pass it to anybody else, but there's nobody to take care of me, so I'm taking care of myself. So pop a couple Tylenol, half an hour later, fever comes down. There was one day I thought, well, you know what? I'm going to let my body fight this. Let me see if my body can fight it on its own. That was not a good move. And so again, it was going out just over 103. I said, okay, couple Tylenol, half an hour later, back down. But brain fog and the lack of taste and smell were the kind of the biggest symptoms. You're feeling okay, but a job that, let's say you're composing an email that might take 10 minutes, it ends up taking like 30 minutes because you just can't concentrate. And definitely the sense of smell and taste. Oh my gosh, what that's hard to live with for a guy who likes to eat food. It's I have lemon. One of my favorite smells in the world is the lemon blossom. I had my lemon tree was out blooming. I said, oh great, let me use it. First blooms, nothing. Could not smell anything.
And how long were you, how long was the hardest part? And then, how long was it lingering till do you feel better now? Like you at 100% now?
I'm 100% now, but I still have this lingering occasional cough, which is a pain in the butt because, I don't know whether I'm still carrying it or not. The fever stopped over a week ago. I'm feeling 100% energy. Everything is back to normal, but 10, 12, 15 times a day, I'll cough once. Somebody says, take a lozenge. There's nothing to take a lozenge for. It's just one cough, and then half an hour later, maybe another cough, maybe an hour and a half. I'll go 3 hours. So it's just, that's the frustrating part because am I carrying or I'm not?
So have you been back to have you seen your doctor or had communication about this question about this lingering cough and the shedding of the virus?
I've had the conversation. I've not gone back to see the doctor. There's a care team that Millennium Physicians Group has for COVID-19 patients exclusively. I think there's 4 nurses. I have one guy that's assigned to me, and he checks in about every 4 days. Talked about breathing exercises, give me some deep breathing exercises to help get air and oxygen deeper into your lungs than from our normal breathing. The big thing is they want to make sure that you're not going out of the house. Do you have money? Do you have credit cards? Are you okay? Can you get access to food? And because they just don't want you infecting anybody else. So I've been homebound for 4 weeks today.
Wow.
And I'm still, as long as I have a cough, CDC, on the CDC website, you have to count 72 hours after your last symptom.
Wow.
So, yeah, so it's
So you're making good use of home delivery?
absolutely.
For
I
everything.
joined Instacart. So I had, in fact, I had two almost simultaneous deliveries yesterday, one from Whole Foods and one from Costco. So I can get my fresh fruits and vegetables. You know, I've had some neighbors, bring over food. I've had, different friends offer, hey, can I bring you anything,
Nice.
And so that's been great. And I've made great use of this time. I mean, I've shredded probably 25 pounds of old documents and credit cards.
Right,
and,
right.
And I'm not going stir crazy. And being a social photographer out at all these different galas and events, I would have thought that I would have shot myself by now.
What do you think of the whole social distancing thing? Do you think it's kind of a silly question for you because that's all you're doing right now? And do you think it's working overall? And do you see or hear from people obeying that where you are in Naples?
They are, and I thought your guest before me, he was very eloquent and he was great. And I love the concept of him using the term physical distancing.
Yeah,
that you guys need to promote that on.
I know you're right,
and that needs to be the talk of the country because that's really it's physical. It's not social distancing. We want to be social. So it's that was brilliant that you guys had that discussion. So, but I know that the physical distancing, you hear all the studies, and of course I have all the time to be researching this stuff like crazy. So I've got 4 screens on my one computer because I'm originally from Canada. I've got the Canadian death totals. I've got Florida, I've got the world, and I've got the US, and I'm looking at the updates, but I'm also following the CDC and a lot of the news programming when they're interviewing actual scientists who, in infectious disease. And, I know they're huge on it. I'm glad I'm doing it. It's funny. I had a friend of mine who so wants to physically distance herself. She says, "Do you need anything?" I said, "Well, I'm out of eggs." She says, "Well, I'm going to Publix." So, she didn't even drive into my driveway. She parked on the street and left the bag of eggs at the end of my driveway and came out of her vehicle wearing a mask.
Oh, wow.
And I'm like 50 feet away. So it was, so she was definitely taking physical distancing very seriously.
So go ahead.
But I know that if I had done this, if I had adhered to, and again, this is before it was even discussed, but here in our office, if we had adhered to the physical distancing, I probably wouldn't have it.
I think the other thing too, you brought up a good point, was the cleaning of the shared equipment, because my daughter and I went to the bank a couple of weeks ago, and it was constant. You touch it, you clean it, they touch it, they clean it, the computer mouse and the computer keys, because this stuff can live for a certain amount of time on hard surfaces.
Yeah, absolutely. In fact, I took 2. I did 1 bank deposit. Now I'm doing it remotely, but hand sanitizer, had to write out the thing with the checks, and then I actually even wore a glove when I took it to the drive-through, and now I just do completely online banking. But yeah, I completely sanitized it as soon as I knew what was going on. I've sanitized my place several times, even though I'm the only one here. So my place is going to be pristine
Nice.
if a client comes into my studio for a headshot.
So there's going to be no need for lobbies and banks anymore when this whole thing's over. That's one thing. I mean, why would you need to go into a lobby? Everybody's doing it, or maybe even ATM machines. Who knows if they're going to need cash anymore? But yesterday, after we got the tire fixed, I got a flat tire. We got an oil change. The lady's like, "I washed all your keys off. Here are your keys back." She washed all the keys off before she handed them back to me. Now, how long is that going to last before they wash the keys off all the time? But that was an interesting thing. I looked at her like, well, I guess I get that.
Well, I think it's going to change how we do things. And you just mentioned how it's going to change, that your studio, you're going to be cleaning and it's ready to go, but going forward, and I'm sure you've been doing stuff before, but I mean, now it's really going to be top of mind for everybody to just really be cleaning every surface where they are and where they go and when they get home.
Yeah. And now that my coworker, my employee, and myself are both, I'm sure I'll be recovered in the next couple of days. We're actually going to be the only photography studio probably in South Florida that we're kind of in an elite group because we've had it.
Your immune.
If all the scientific indications are there,
Right.
we're not going to be able to pass it on. So I can go into somebody's office. They don't have to be freaking out about, oh my God, am I going to catch it? Hey, been there, done there. I got the T-shirt.
Right.
Well, Charlie, thanks so much for your time. It's great to hear that you're doing great and you look great, and and I could smell how great the house is, nice and clean from all the way up here in Gateway.
Yeah, life is good.
Thanks a lot, man. Good luck with the business too. Hopefully everything will get back to normal soon.
Great. Thanks a lot. You guys have a great day.
Holiday.
Yeah.
Charlie McDonald, everybody from Naples. Check him out online. He's got a photography business down there in Naples, and he's going to have the cleanest photography business when things are ready to roll. Let's get our final guest up on the screen. Last but not least, remember the last time? Am I yelling?
Loud, yes.
It's my radio voice kicking in.
Well,
Janine, we tried to pop her on last time, and we had some sound issues, but check 1 2, check 1 2. Are you there? She looks like she's Janine. Are you ready? Janine. Now we must be having some. Can you see us? Can you hear us? Hi, Janine. You look so pretty. Say something. You're on. No sound.
No sound.
We have no sound again. It's crazy.
You've got it. I'm
Janine,
sure
the
it's you.
shirts look great. I love the shirts. Turn your volume up.
Oh,
there she go. It must
Well-
be. What is the thing with Janine? One thing I wanted to mention
oh
to
boy.
folks.
Here we go, folks.
that
Check this
One
out.
of the reasons you should never shop for toilet paper on Amazon is because things always appear bigger in the rearview mirror than they do in person. This is a $16 roll or package of toilet paper. That is very small toilet paper. I would use one per sitting.
It came
who
from
sells
China.
toilet- how would
it came
you
from
ever
China.
think
I
that
don't know
toilet
if they have
paper rolls
smaller.
were going to be that small?
I mean, maybe in
Who-
China they have smaller toilet
I
paper.
know, but
rolls.
where? I've never seen in my life until I bought it. So $16 for
It's gotta go
12
back.
rolls of toilet paper. Incredible thing. There's Janine again. She's back up. She's got no sound again. Turn the volume up on whatever. I can't believe this. We got jinxed.
She's got her headphones on.
I know she looks fabulous. She's got nice pictures in the background
I
there.
know.
Yeah, and she's got her shirt on. But she can't hear us and we can't hear her. So thank you, Janine, for joining us again. We don't know what happened. Isn't that strange? It's happened twice with Janine. Now
Well,
you're going
I
to blame it
think
on me.
I
You
am
blamed it
gonna
on me
blame
the
it on
first
you
time. How
because-
could it be my fault this time?
Because did you do a pre-check with her?
I did not because I forgot to send her the link.
All right. Well, you have to do a pre-check because you think it's easy to do and they don't. Well, I can tell you that they're I don't know how many T-shirts now they've sold.
I know. We
I'm
got to get all
sure
that
it's
information.
tons and tons and tons for the hashtag We Are FMB.
Right. The shirt that I'm wearing, we are FNB.
And the money is going in gift cards to service industry workers to
Right,
help support them
right.
through this difficult time.
$28,000 raised. Look, we're
Here
going to do
we
it
go.
like this. We'll
Yeah, there
figure
you
it
go.
out one way or another. 28,000. What's the website? Put the website on there so people can figure out where to go. Where do they go? The website. Post the website. I can't believe this happened twice.
I can't either.
Yeah.
Well, that's
Actually, that's a good idea. You keep talking, Gia.
Okay.
Call my phone and we'll pipe her in on the phone. Call my phone. Call me. Call me.
So
We'll put her on that way.
$28,000 raised so far, and that money, like we said, is in gift cards for, I believe, groceries for folks to go. She said 360 have applied, so 360 people are benefiting from the monies that have been raised from you guys purchasing these really cool shirts. The color is amazing. It's actually the color of the little bar at the bottom. It's a beautiful light tealish color.
Hi, it's Janine.
We
I'm
both
taking a
have
call
them.
right now, but if you leave a message, I'll get back to you.
I'm getting her voicemail.
Oh, well, she's doing it. She's doing it on the, she's
Oh, there
popping
she
it up.
is. Hold on. Hold it.
Oh.
Accept.
We might have her on the phone.
Yep. Let's see.
Hi.
You're right, Eddie.
Oh, we
It
got
is
you.
his fault.
I don't know. It's the iPad, so I'm so
Oh, using an iPad. No worries. We got you on now. We figured it out. There's always a plan B. So you told us $28,000 has been raised.
it's incredible. $28,835.
There you
At
go.
the end of this weekend, we are going to reach that $30,000 mark. Which
30,000.
is incredible. Everybody, your T-shirt, buying your T-shirts, your donations are coming in. We had hoped when we started this program to raise $7,500. And we are so proud of our community and the people up north that are buying it to support our community. It's been great. I'm so proud of our team. It really is a team effort, and our community is included in that team. So I have some other really exciting numbers.
Okay, cool. Before you do that,
Yes.
Can you lower the camera a little bit so we can see your? There you go. Now you're in the full screen there, and
full screen.
there you go. There you go. So you have more information. So go right ahead.
Okay, so we have had 360 hospitality workers apply so far. So we're still looking for applications. So if you're out there or you're a business owner and your employees are not working or have been displaced, visit the Fort Myers Beach CF.com website, which will be in the comments. Our PR person, Tanya Keller, will be posting that information. So download the application and take a picture of it and then email it to us. So we want to get help in the form of a $50 gift card to Publix. And we started the distribution of that already.
Mm-hmm.
And I'm excited to say that we've already done 245 gift cards that have been given out. And this has only been 3 weeks. 3 weeks ago today, Anita and I had this idea.
Right.
And it's great. We need more applications to come in.
Are you able to turn the shirts around as quickly as you'd like to? And are you getting a good price on the shirts?
We are very, Krusty Pete's, Dave Anderson is amazing. He got us a great price. The shirt cost is $5, so $10 of that $15 goes back.
Awesome.
The price of $21 covers the postage for the shirts. So it is a great deal that we've gotten from Krusty Pete's, and he has been working tirelessly day and night. I can text him at any time and he'll answer, so that's really cool. And the turnaround time has gotten much better. We did not anticipate. We bought 500 shirts in the very beginning, and to have sold this many, we're on our 7th or 8th run of shirts.
Wow.
We actually sold out one of the distribution houses of this color in shirts. So now we're having to travel to other places to get this color because everybody likes it. It matches the bridge, as Anita pointed out to me the other day.
Yeah.
It matches the bridge, and it's a great color.
Plus, you want to see the same color shirts, and you want to see everybody walking around in them, and you know exactly what it is because it's kind of unique.
It is.
Now
Definitely.
you said this. Go ahead.
I see people. It's really cool to be, when I'm dropping something off on the beach. I live in Estero, so when I'm coming to the beach and I see people walking around and riding their bikes, it's really, really cool. I love it.
Now the shirts are $15, but you will take more.
And
encourage more.
We do, and people are so generous. They'll put in, $100, and
Nice.
we email them back, and they only want 1 or 2 shirts.
Nice.
We've had people just yesterday. We did a distribution. Kelly Smith and I did a distribution, and people asked what we were doing. When we told them, they gave us money. I think we raised $100 yesterday, just sitting. People were curious what we were doing. They think we're a testing site, which, we have to let them know right away we're not a testing site.
So, Janine, let me ask you this. And you don't, like if you place an order, do you place an order for a certain number of shirts?
Yeah.
And is that order, what I'm trying to get at is if somebody wanted to call you after this show and say, I'm buying the next batch, what would that price be?
Actually, we've been buying them in bulk. After the first week and how many shirts that we sold and not knowing, Dave went ahead and just bought out like that one distribution house. He's keeping ahead of the order. This is what he does for a living.
Gotcha.
We told him 500 shirts. So he has shirts in stock. It just, sometimes the mediums go faster than the extra larges and stuff. So we do have shirts in stock, and we're down to filling the orders within 2 days. So
Very nice.
They can either pick them up or a member of our team will deliver them. Jan Fleming is head of our delivery. She's doing amazing. And so, our turnaround time is so much faster. People up north have them. They're sending in their pictures. So we're actually going to do something really super cool. We're going to announce on Monday in conjunction with the Fort Myers Beach Film Festival. So watch Monday night, our Facebook page for a really cool announcement on what we're going to
that's a teaser right there, everybody.
It is a teaser.
When you were talking about people sending in pictures of them in their shirts, I was going to ask, is there something that you're doing, to show that? But I don't want to do that. That's going to give your stuff away.
I will again say the Fort Myers Beach Film Festival, and Kyle Thompson is our programming director. He's up in Philadelphia, so look for a message from him Monday night on what we're doing now.
What did you just ask? You totally lost me. Like now you're speaking in tongues and I don't even get it.
She's got it.
We got it.
Where I'm going.
Just move on.
Okay, how many shirts do you think are out there in the sphere there, in the ethosphere?
I wish I knew how many shirts were out there because of the donations. Jan Fleming, there's so many aspects to this. We thought it literally was going to be buy a t-shirt, get a gift card, and record it. And it's taken on where we all have departments. So I'm kind of overall with Anita, we, talk daily on what we're going to sell next. We actually are going to sell some more stuff because everybody, again, we said this is not just about corona virus. It's also about being a community. And we hope that people will use this in the future for positive things. We have some ideas on what we want to do as soon as we are all able to go out and socialize again. So there'll be a #WeAreFMB event that we'll do somewhere, or else island-wide. We're still putting all the details together on that. So it's really a positive message. It's all about our community. And $28,000. I'm telling you, by Monday I'll have a $30,000.
You created a monster here.
You know what? No, we reminded everybody who we are. We reminded everybody that we are Fort Myers Beach, and we will all get through this together.
Yeah, and this can't end when the virus is over, right? You have to keep it going now because it's it's a movement.
It's a movement. That's what we said. Anita and I said it was initiative, and now it's a movement. And we're so excited that everybody's participating and want to help and sell shirts. And we practice social distancing, so.
We call it physical. We call it physical distancing from now on. Okay, just so you know that.
Physical distancing.
And you know what? The shirts and the movement are a way to get back socially. So I mean, it combats that. Yeah. So you can maintain the physical distance, but still be socially active by joining this movement and supporting this movement and the folks at the beach.
Yeah, definitely. And I look forward to seeing everybody on the beach, as does everyone else. I miss it. I'm in Estero. My parents live on the beach, so I'm there all the time. Most of my friends live on the beach, so I can't wait to get back. I'm on the beach a little bit doing deliveries or the distribution sites, but I can't wait to walk and put my toes in the sand again like everybody else.
You keep saying Anita. Anita who?
I know. It's this woman.
Citizen?
I met her like 25 years ago, and she's like a big sister to me, but I don't think anybody else knows her.
We had her on the show the other day. Her hair looked fabulous. She looked very relaxed. And
I got up, I washed my hair today because I did not want you to comment on my hair.
Now, why would I do that? It's me and Anita got a hair thing. That's what it is. The two of us.
I text her, actually, while she's on, I text her and I'm like, nice hair.
That's why we have these hats. So that I don't have to worry about that.
Cool.
Yeah.
When people are walking by, you lost your lighting there. You lean forward a little bit. There you go. There, it's back.
No, it's my computer going in and out.
Oh, okay. When people, we got to send you out some lighting and a green screen, and although you got lots of pictures over there, so.
It's all film festival related.
Oh, very nice. What?
Can you pop up the website in the comments?
Okay.
Go back up.
All right. Let's see. Tanya has been on here kind of popping things up so people can see it.
Speaking of,
there it is right there.
Yeah, we're going to pop up the website. There
Tanya
you go.
is our PR. She's volunteered our PR. I think I mentioned this before. She's up in Virginia. That's how far she, her husband, Randy Keller, was in the command here in the Coast Guard on Fort Myers Beach. So they have strong ties to the community. So she's volunteered her time as well as Jan and Nita and Kelly Smith, all the community foundation, everybody.
Well, if you're thinking about other items, hats sell really well too.
That'd be cool.
Nice.
Yeah.
I know there were some, people have had crazy ideas on what we should sell. And they're funny, but hats are a good one. We've got some other little
beer mugs. Beer mugs would be good on the beach.
Koozies.
I don't know about the koozies. People like
hand sanitizer.
They don't need our ideas.
Well, we're going forward, so we're hoping. I mean, hand sanitizer is always going to be used, but we've had some dog bandanas suggested. So people, because they're putting their dogs in the shirts, which is super cute. So we'll do some dog bandanas and keep it going because we want people to keep donating. And after everybody has their shirts, then the next step will be something else.
When you're driving down the beach or walking down the beach, I don't know if you're allowed to walk or
No.
whatever. When you're on the beach and you see somebody not wearing a shirt, do you yell out the window, "Hey, dumbass! How come you're not wearing one of our shirts or something?" I mean, come
That's
on.
That's pretty much what I do. If you see me, yeah. But I'm smart enough to use my son's car so that they don't know that
Nice.
it's me.
Nice.
My son's car.
Very nice. So, go ahead.
No. I was
Anything
reading.
else you want to share with our 9 listeners today before we got it to
No.
work, which was nice?
I know we have to do this. I don't know. I guess something with the iPhone and the iPad, and I apologize.
No
for that.
worries. We have to have you
Right.
on a consistent basis so you can keep giving us updates. And you can keep telling us how the shirts are selling, and we can keep guilting these people into helping everyone on the beach. How are the folks that you're helping? What's the response you're getting from those folks? Because I mean, they're just getting killed.
You know, my son and I do this funny thing. Because we're quarantined now. He's still working, but when he comes home, we practice. He has to leave his shoes outside, shirt, clothes go in the wash machine immediately. So otherwise we're home. And so we're doing these live Facebook videos for our family, and they're very funny, and we bicker like crazy. But last night I did talk about how I'm so blessed, and Kelly, we're so lucky to be on that end of it, being able to give out the gift cards to the workers, that I want everybody to know who's donated. They are so grateful. They are really, really grateful to receive the cards. We had somebody that burst into tears yesterday, and you know, hopefully that will raise enough money that we can go through the applications again and give more. They, you know, go right to the grocery store. And I met somebody in Publix yesterday, a worker, the customer service manager. She told me that there was a lot of happy people using gift cards yesterday.
Cool.
So everybody who's donated, it is helping, and they're so grateful.
Great. And you know, sometimes people feel like they don't want to accept something like that because of whatever reason, their pride, or they don't want to be looked upon like somebody's giving them a handout. They shouldn't feel that way. Everybody wants to help. There's no reason to feel that way. They should come forward if they need something and ask for something, correct?
Absolutely. It's not a handout. I mean, they've earned it. They're separate.
Right.
They provide, the hospitality industry is our business on the beach. And so they're part of it. So they need to come, and we want to help them, and they help us in all of our businesses. I have, you know, the event planning business. I need people to come back here to Fort Myers Beach, and they're great. Every one of them who has come up has said thank you. There has not been one person who seems ungrateful or anything. Yay.
Great.
All right,
Well, that
Janine,
is really good.
we're so happy to have you on, and maybe we could do this weekly if you're not too busy. I mean, I'm sure you're out and about, or wait. Oh no, you're not. You're not.
I'm not. No.
All right. Well, you have a great holiday weekend, and thanks for coming on.
All right. Bye.
Bye.
Janine, everybody, there
Happy
is
Easter.
Happy Easter. There, we'll leave that website up there so people can get on there and donate some damn money. People, you
So
keep acting
loud.
like I'm yelling. I'm not really yelling. I'm just being vociferous.
Boisterous.
The doctor interview was killer. That thing. I'm gonna snip that interview, and
I
gonna
have
post it
to
up there,
say,
and
you
he
know,
was
we
brilliant.
have to give him the credit, but we can certainly get out there and start hashtagging that physical.
Yeah, we're taking full credit for that.
That's a great term.
It was so nice of him to come on, and the way that happened was I had to make a connection with a broadcast friend of ours in Syracuse at Galaxy Media. He hooked me up with the PR person at that university hospital, and then she said, "Oh yeah, absolutely. I shouldn't say rather, but it would be nice to have Dr. Antonucci on." And I've been working that angle in from Lee Health, because we obviously want to know what's going on locally. We can read this; they send out stats every day, but it would be nice to have him on if we could.
It would be nice, but a lot of this this is a global thing, and it's certainly a U.S. thing.
Yeah.
So a lot of this
His
information
awesome.
is relevant to folks in general. Tanya put up there, she wanted a reminder that the forms are available in Haitian Creole and Spanish.
Oh, wow. Pretty cool.
So that's good for people to know. And Mr. Lalo said his employees were grateful of receiving the gift cards. So,
yep.
It's getting out to people. And
Tanya's from Syracuse. Look at that. You could tell by what they're wearing. So,
yeah.
Well, oh, by the way, we want to thank the mayor,
she's
Ray
in
Murphy,
Virginia, but maybe
for
she's
coming
from
on.
there. Yeah.
Last night. If you didn't see the video last night, the mayor came on and gave us an update on his call with Senator Benaquisto and I guess probably Kevin Ruane and the Mayor Henderson, they all kind of get together and do a powwow. I think they do it every day.
I don't know. I was late to that party last night.
He was
so.
not happy that you weren't on the call to begin with. And I made up some lie excuse about what you were doing. And then you spent the whole night. And then you spent the whole night on the stream yard with your mom and your sister. What?
Yeah. Well, I have to say, the doctor, when we were talking about physical distancing, not, and increasing your socialization during this time. And so, it's hard for everybody to figure out how to do things. So, we're educating my mom on how to do StreamYard so that we can all, because the FaceTime doesn't always work in a group. And so we can all get together and hang out and at least, see each other that way.
Did you call John Mr. Lalo?
I might have.
He didn't really like that. It makes him feel old.
Not old, just respected. We respect him.
And we also want to thank former Mayor Anita Saracita for putting up with our little fun show that we did on. Was that Thursday?
You kind of ambushed her. She was not prepared.
We had a bunch of her friends come on, Tom Torgerson and
I didn't really know, or I would have probably leaked the secret.
Yeah,
because I don't like surprises.
So that's a Thursday night video. All the videos are in the video archive, and obviously we have nothing to do, so we're just rambling on about nothing.
Time to wrap it up.
Yeah. We had 2 flat tires on the truck this week. And remember, never shop for toilet paper on Amazon because the pictures do not portray the right size rolls of toilet paper.
Objects are definitely smaller than they appear.
All right, everybody. Thanks a lot. And if we have more news to share with you during the week, we will pop on the Facebook. We have a great interview last week on Facebook that we did at my regular job with somebody about the small business loans that are just everyone's having a nightmare time with trying to get loans. And we're supposed to have our checks from the government on the 15th or by the 15th. So that'll be cool. Save that money. Spend it on the beach. All right, everybody. She's going to dance it out and we'll see you in a week. John wants us to go to Pete soon.